Tonight, the CDC says it will screen and monitor travelers from areas of Africa where a rare and deadly strain of Ebola is spreading. At least 6 Americans there have been exposed, with 1 testing positive. Tina Kraus reports.
Medics on the front lines in the Democratic Republic of Congo are racing to stop a fast-moving Ebola outbreak that has now spread to neighboring Uganda. Health teams are scrambling to contain the strain that has no approved treatment or vaccine. The CDC confirms an American missionary working in the Congo has tested positive, and the agency is working with the State Department to move the patient to Germany for care. At least 6 others have been exposed.
The risk to Americans right now is very low. Ebola is not something that spreads through the air. You have to have direct contact with somebody, their bodily fluids. But at the same time, if we allow this to spread uncontained, that does start to pose risk.
The rare form of Ebola is called the Bundibugyo strain, only the 3rd known outbreak with a fatality rate that can reach up to 50%. It has hit one of the world's poorest regions, where many don't have access to basic health care.
These are really hard to reach areas, mining towns, on borders, really vulnerable communities.
Since Friday, the number of suspected deaths has more than doubled to over 80, and hundreds more cases are suspected. Global health experts are warning the Trump administration's cuts to USAID and withdrawal from the World Health Organization could make it harder to respond and contain the virus. Tina Kraus, CBS News, London.